I will now demonstrate you the treatment with laser needles in the face, on the ear and on the skull. You know, treatment of face and skull and ear is very effective in acupuncture because especially in ear acupuncture the stimulation of the points and the nerve inputs are going directly and quickly in the brain. But we have a big problem because, you know, on the skull we have hairs and we cannot fix with our well-known sticky discs. So we have to use a different technology. Also very interesting is the infrared laser on the skull because the infrared laser can go through the bone transcranially and stimulate directly the brain. For example, in stroke patients or Alzheimer's disease. We developed here the special patented Weberneedle head adapter, which we can put on the skin, and by turning the button behind, we can fix it in a comfortable position. I demonstrate you now how the needles are fixed on the so-called flexible wires. So at the end of this flexible wire, we have small holes, small adapters, where I can put in the needle inside, and then I fix it in the upper part of the non-flexible wire. So you see now I have an instrument which carries the laser needle, which I can later put on the complicated structures in the face. I will demonstrate it first in the well-known point, large intestine 20, what we can use for sinusitis, for example, or chronic rhinitis. You see that we have a lot of different plugins there. It is important that we always use the plugin which is placed exactly over the point what we have to treat. So you see I put in the plug of the flexible needle carrier over the point large intestine 20, and now I move the flexible wire with the carrying needle very close to the treatment point. Now I pull the green plastic back and the guiding wire forward, so the needle goes with a slight pressure directly on the treatment point. And you see the patient can move his head and the needle stays in place. So if I want to change to another place, you see I can move the flexible wire. I go with my needle close maybe to the extra point of the eye, and then I push my guidance wire, the metal one, forward, and I pull the green plastic back, and you see I have a wonderful fixing on the complicated structure of the face. Now I demonstrate you how effective we can treat with laser needles even on the complicated and difficult structure of the ears. You know, the whole human body is projected on the ears, so in the down part we have the head, and in the inner side we have the inner organs, and in the upper part we have the extremities like knees and legs and fingers and toes. So again I choose the plugin which is placed directly over the treating point. You see I move my flexible wire close with the carrying needle close to the treatment point. In this case I treat the shenmeng point, and again I pull the green plastic over the metal small guidance wire back, and exactly I can fix the needle on the ear point. So I will change to another ear point. So maybe I go to the thalamus point, the main pain point on the ear, and again you see I pull the green plastic over the metal guidance wire back, and then I fix my needle on the acupuncture point. Of course, this needs a little bit training, but it is a very nice technology, and the effects of this method on all pathologies are very quick. So with this technology, I can even treat inside the ear. I can directly irradiate inside the ear, maybe for hearing loss or for treatment of tinnitus. So in a next step, I will show you how to treat in the head area. This is normally quite difficult because, of course, it is very, very difficult to fix needles between such dense black hairs what this patient has. So let's treat a point now on the government meridian, maybe the main point, government 20. So this is a very important point. So with this technology we treat pathologies like stroke patients, Alzheimer's or Parkinson's patients, or dementia. So again, I choose the right plug-in on the side. So the cable is plugged in. I move my flexible wire with the needle at the end close to the treatment point. And now I pull again the green wire, the green plastic wire back over the metal guidance wire. And now you see I can treat exactly on the skull with the attached laser, even between black hairs. So I cannot only stimulate acupuncture points on the skull, on the different meridians like gallbladder or the government meridian. I also can treat effectively transcranially the inner structure of the brain. Of course, several people, they prefer more a lying position because it's more relaxing. So I will now demonstrate you how to work with this technology in a lying position. For this, Weberneedle has developed a special pillow where the head of the patient is lying. And we use now a different adapter so that it will not make any pressure on the neck if the patient is lying in the ring with his head. So the patient moves his head forward and will lie down now directly in the ring. Also for the therapists, it's a very comfortable position, of course. And many therapists are choosing the points maybe by pulse testing, and so you can do it in a very nice and relaxing position. Again, look here how we do it. We fix the needle here in the adapter. We fix it in the upper loop of the metal wire. We look again for the right plug-in, what is directly below the treatment point. We put the plug-in. Okay. We bring the needle in the right position by moving the flexible wire, and look here, we pull the green plastic back and move the metal small guidance wire forward, and we treat now exactly the ear point, the very nice relaxing position of the patient. So again we move to the thalamus point, easy to do. We go to the other point, change the position, push the metal wire forward and move the green plastic back. So in the same manner I can treat, of course, lateral points on the head, for example on the gallbladder, for example, if I want to treat lateral headache. You see, I change now the plug-in. Again, I push the metal wire forward and can apply my laser needle directly between the hairs on the skull. So I can treat the whole area of the skull and also facial points in this position. So we now show a treatment on different points. First of all, we treat the Shenmen point with the red laser. We change the angle according to the structures of the ear. You see, now the point is exactly treated. And now we use the green laser, which is a nice laser because of low depth penetration depth for the ear, and we will now treat with the green laser additionally the thalamus point. We move again the needle to the point. We are very close. Now push the guidance wire forward and move the green plastic back. And now we combine Shenmen point with thalamus point, which is a wonderful combination to treat acute and chronic pain. So if you compare the red light on the ear with the green light, you see a much bigger spreading of the red light and a much lower spreading of the green light. The reason is that the green light is absorbed, of course, by red blood cells, and the red laser is scattered and reflected by the red blood cells, so there is a bigger spreading. And the big advantage also, if we treat with laser needles instead of metal needles, we not only treat one point, we treat an area.